It's by far the worst COVID outbreak we've had in the Territory. However, it currently appears to be reasonably well contained to the Katherine region. So it obviously hasn't spread further to the centre or up to the top end, further up the top end, which would have a much bigger population impact.
But you do expect wider transmission will be confirmed in the coming days in Katherine and possibly Robinson River?
Yeah, well, again, that's roughly the same area. So it's known as the Big Rivers area of the Territory. And, yeah, potentially, I mean, the thing comes down to very crowded communities, a lot of people living in houses, a lot of communication, a lot of social communication between Aboriginal families, which of course encourages the spread of the virus.
And so this is a great concern, isn't it? How will the medical system in the Territory be able to cope if further transmission does occur?
Well, again, there's been a lot of health planning underway to try and accommodate these pressures on top of the already very heavy pressures affecting Royal Darwin Hospital.
The Labor Senator Malarndirri McCarthy has criticised the pace of the vaccine rollout and says a lack of strong messaging has left the Territory and specifically Indigenous Australians vulnerable. You are there. Do you think it could have been managed better?
Well, my view is, again, that it could have been messaged in a different way. I mean, what we've done is the usual thing of authority figures, looking at a camera and saying, get the vaccine. There's been a lot of other groups apparently influencing people, particularly in the centre of the Territory, which has led to low vaccination rates. I mean, my view is always to try and get some Aboriginal bands, local bands, to develop some racy little tunes promoting trust the health mob, don't listen to this other mob type thing. But that voice has always been in the wilderness. And that, that's what people listen to they listen to music, they listen to the bands playing, and that would have a lot more influence, I think, on social media rather than authority figures giving wise messages. But anyway, that's just my input.
Have there been specific strategies to counter any vaccine hesitancy in Indigenous communities in the Territory?
Well, they're always trying, and there's been some good efforts to do that. But there's obviously these groups that are anti-vax have been quite influential in the messages they've been putting out, and probably much more effective in many ways than the government messages trying to get people vaxxed, which is a real concern.
And so what are the strategies which do work?
Well, again, what seems to work is when there's a strong community cohesion and you've got community leaders saying, look, you just need to get vaxxed people. And particularly with the communities where there's a lot of Aboriginal leadership and a lot of cultural leadership required. That seems to be the key point. But there's also role models. I mean, as you're probably aware, the Territory's AFL mad. So people like AFL footballers, both nationally and the Territory, can have a lot of influence if they give the right message.
Was the New South Wales outbreak in Wilcannia looked at in the Northern Territory as a bit of a wake-up call for what could happen?
Well, the AMANT and AMSANT have always been saying, given the potential risks, Indigenous Territorians who represent 30% of the Territory's populations are much more vulnerable to really serious medical complications from COVID because of their they've got a lot of diabetes, they've got a lot of chest disease, a lot of heart disease. And so, AMSANT and AMANT have always talked about 95% vaccination rates in Indigenous communities to counter the potential health risks of COVID arriving in those communities. And I suppose just what's happened in Wilcannia has just justified what the AMA and AMSANT have been talking about.
So just finally, in terms of actually containing the outbreak that we know about right now and ensuring that the vaccination rollout can take place as quickly as possible, is there anything else you would like to see on the ground?
Well, again, the Territory's putting resources in terms of monitoring, testing, trying to contain the outbreak. One of the good results was that Robinson River apparently is 77% vaccinated. So I think that was a pretty good result for Robinson River and good on the people there getting the vaccine. And some communities have really enthusiastically embraced the vaccine. So I think that represents a good story as much as the other stuff happening in Katherine, and hopefully because of these positive attitudes to vaccination and because it appears to be reasonably well contained in Katherine. Hopefully the Territory will survive a more difficult situation.